My name is Ashraf. I'm the CTO of EHS and Vice President. I would like, first of all, to thank ArabNet that gave us the opportunity to share with you our success story. Our program is Hakim, is the national e-health program in Jordan. EHS is a non-profit company owned by the kingdom's main healthcare stakeholders. Ministry of Health, Ministry of Information Technology, King Hussein Cancer Center, King Hussein Institute for Cancer and Biotechnology, Private Hospitals Association, and the Royal Medical Services. Our vision is to transform and sustain a continuously improving healthcare system in Jordan by leveraging technology. EHS is implementing the first national e-health initiative in Jordan, Hakim, based on the Veterans Association platform called Vista, which was selected for the computerization for the healthcare sector in Jordan. What is Vista? It's not Microsoft Vista. It's open source. It's the Veteran Health Information System and Technology Architecture and Enterprise Information System used throughout the United States Department of Veterans Affairs, called VA. It's a collection of about 100 integrated software modules that covers all medical aspects. Vista offers a proven open source, enterprise-wide, fully integrated, fully functional, scalable information system built around electronic health record. It is installed around the world, like you said, in Egypt, in Africa, in Europe, in South America, and the United States, and as you see in Jordan too. We do that by merging health with technology. EHS has areas of expertise for both sides. We have technical side from software developers, from network specialists, hardware infrastructure team. We also have the clinical team. We have doctors, nurses, pharmacists to be able to do the clinical transformation and implement the life cycle of the whole project. EHS has its own methodology. It's called the 3TD methodology, which it's define, design, develop, transition, and deploy. It's a set of comprehensive steps, guidelines, activities, and our principles that EHS structures as framework in solution development and implementation. It empowers individuals with timely and understandable steps for solutions, implementations, and drives important quality of services. We have a software team. Our EHS software team has obtained enough knowledge to carry out Vista configuration, customization, developing RPC and GUI application, and build patches and system management. We contributed back to Vista open source community and healthcare industry. EDIS is one of the examples. It's for an ER deployment. We have to install what's called EDIS, which is Emergency Department Integration Software. We've done a lot of fixes to it, and we send it back to the open source community so they can use it. Our software team has evolved and elevated their caliber to become a trusted source of this technical knowledge, and will continue to do so. We have a network team. We use the cutting-edge active and passive network components to ensure security, high availability, and redundancy. We compile with the medical-grade network, MGN standard. We utilize our national brand network, NBN, which is another government initiative that connects all government entities through the fiber optic. We have a very qualified and well-trained network staff. We also have an infrastructure hardware team that they build data centers and they deploy data storage to enable a single archive that addresses capacity, scale, distance, management challenges, and deliver online access and authenticated information whenever is needed. All the operation servers designed to be redundant within the same data center, from cluster, redundant power, redundant cards, fiber redundancy, and FM200. We have a service desk. We review our service desk based on ITSM framework and ITIL best practice. They develop and train. They offer 24/7 centralized help desk support to all our clients. We provide high quality services through efficient staff, processes, and tools. Knowledge transfer is one of the key factor to sustain this project. We do that by conducting systematic workshops and classes. We sometimes use some consultants and short-term expertise on needed basis. The on-site monitoring and shadowing, and we do collaboration with World Vista and GTM and Linux. All this get documented for any implementation or future implementation. Building Jordan experience. I mean, building capacity within Jordan is the key to sustain this project. Again, we do that through 3 steps. We do that on-site mentoring by assistant competencies, practical skills workshop. Then we do the configuration classes and KT sessions that cover the AdPack curriculum, VDL document, configuration competencies, and then we'll go back to the site configuration test by doing a full modular assessment and configuration of a new site. And they all go back in feedback to the first 2 steps. Clinical transformation processes. Managing the clinical transformation workshop at site by collecting and validating data and information. We build and train health experts for clinical transformation and workflow expertise based on best practice. Managing the activities of the change management, communication, and benefits. Clinical transformation phases, as you see, they all interact and link together. As anytime we go to a site, we have to understand their current state, and we know the future state based on best practice. We do the gap analysis, then we come up with the current state that end up with the site. Hakim program has 5 areas that we think it's the main 5 areas. Clinical, CPRS. CPRS is the computerized record system, computerized patient record system. They also have the surgery packages there and women health. The clinical ancillary services include radiology, Vista imaging, laboratory pharmacy. Integration, Vista integrate with any other application through HL7 messages. Clinical procedures is one part of the integration too. We always have the support like the social work, nutrition, care management, and the record management, which called PIMS, it's Patient Information Management System. The key to our program to have a unified identifier for each patient, and we use the Jordanian national ID. Our software team was able to integrate and use our national ID instead of the social security that has been used in the state. We also utilizing technology around Vista. For example, the wireless cards. Nurses and doctors will have the ability to use the wireless cards to simplify the mobility and the Vista system access. Radiology uses high-resolution diagnostic monitors, and the barcode medication administration, BCMA technology, which is a great technology that aims to reduce medication errors and improve patient safety by providing a safety net during the medication administration phase. The BCMA actually, it works both ways because each unit dose has a barcode, and it will go against the wristband that the patient has, so that will ensure that the medication is going to the right person and at the right dose too. Benefits of Hakim. Hakim program support healthcare modernization across the kingdom as it provides the following. It creates a lifetime healthcare record that is easy to access for patients, comprehensive electronic medical record that includes patient history record, order medication, lab tests, radiology exams, and surgical procedures through the computerized physician system, upgrading hospital network and hardware infrastructure. It also improves safety, quality of care, and better management of chronic diseases, as the system will alert ordering provider of critical lab results, drug-drug interaction, and it will remind providers when their patient is due for certain exams or tests. Improve hospital workflow and provides a platform continuous healthcare procedural improvement. It provides the needed statistics for medical research, reduce waste and duplication, and improve resource utilization. One of the major benefit to have one comprehensive electronic health record for each patient that will be accessible for all facilities and physicians at any site that Hakim program is implemented to. Also, by implementing Hakim, we'll have no more medication waste, as all the pharmacists at all the sites are connected to each other. So there is no way that any patient can go to a different pharmacy, to a different facility and ask for the same medication. No more X-ray films waste. Actually, at one point, there will be no more X-ray films because all the images should be stored at the archiving solution and will be accessed by Vista Imaging from any facilities too. Leveraging services quality, minimize patient waiting time and optimize hospital workflow also. And finally, our accomplishment is the completion of Vista deployment and computerization in Prince Hamza Hospital. It's 400 beds. It serves thousands of people daily. Completion of Vista deployment and computerization in Amman Comprehensive Clinic. Assessment and implementation of 6 new sites that we will be done with this year. One of those sites will be KSCC, which is the King Hussein Cancer Center, one of the elite institutions for cancer in the region, if it's not in the world. Build a Jordanian body of expertise in Vista and in health information system. Our dream is moving toward global record. Thank you.